So, healthline.com, there's an article called What You Should Know About Cancer and Pregnancy, and it implies that cancer isn't automatically attributed to pregnancy. This also isn't meant to fearmonger throughout the video, but it's worth bringing up. At a hormonal level, it's very important to pay attention to, obviously. In WebMD.com, breast cancer and pregnancy, it says rare melanoma can form from certain hormone changes, and certain breast cancers can overlap with normal breast swelling. Both of these articles, or these websites from WebMD and Healthline, remind us pregnancy isn't inherent to causing cancer, but says it can. Of course, prenatal checkups can catch this before it becomes an issue. Pretty sure most women know this, or if they don't, it's just good to know and have somebody talk about it, I guess. On Healthline, it states that 1 in 3,000 women experience this connection of pregnancy and cancer. Anyways, the main problem I bring this up for is, of course, the toll it will or has brought upon women with the overturn of Roe versus Wade. After Roe, pregnant women with cancer diagnosis may face wrenching choices, claims a New York Times article. Alright. In April of last year, Rachel Brown's oncologist called with bad news. At age 36, she had an aggressive form of breast cancer. The very next day, she found out she was pregnant after nearly a year of trying with her fiancé to have a baby. She had always said she would never have an abortion, but the choices she were faced with was wrenching. If she had the chemotherapy that she needed to prevent the spread of her cancer, she could harm her baby. But if she didn't have it, the cancer could spread and kill her. So, she had 2 children, ages 2 and 11, who could lose their mother. For Mrs. Brown and others in the unlikely sorority of women who receive a cancer diagnosis when they are pregnant, the Supreme Court decision in June ending the constitutional right to an abortion can seem like a slap in the face. If the life of a fetus is paramount, a pregnancy can mean a woman cannot get effective treatment for her cancer. 1 in 1,000 women get pregnant each year with a diagnosis with cancer, meaning thousands of women are facing a serious and possible fatal disease while they are expecting a baby. Before the Supreme Court decision, the pregnant woman with cancer was already, quote, entering a world with tremendous unknowns, said Dr. Clifford Hubis, the chief executive officer at the American Society of Clinical Oncology. Now, patients as well as doctors and hospitals that treat them are caught up in the added complications of abortion bans. Quote, if a doctor can't give a drug without fear of damaging a fetus, is that going to compromise outcomes? Dr. Hubis asked. It's a whole new world, he states. Cancer drugs are dangerous for fetuses in the first trimester, although older chemotherapy drugs are safe in the second to third trimester. The safety of the newer and the more effective drugs is unknown, and doctors are reluctant to give them to pregnant women. And 40% of women who are pregnant and have cancer have breast cancer. But other cancers also occur in pregnant women, including blood cancers, cervical cancer, and ovarian cancers. Gastrointestinal cancer, melanoma, brain cancer, thyroid cancer, and pancreatic cancer. Women with these types of cancers, like acute leukemia, often can't continue with a pregnancy if the cancer is diagnosed in the first trimester. They need to be treated immediately, within days, and the necessary drugs are toxic to the fetus. In my view, the only medical acceptable option is termination of the pregnancy so that life-saving treatment can be administered to the mother, said Dr. Eric Weiner, the director of Yale Cancer Center. Some oncologists say they are not sure what is allowed if a woman lives in a state like Michigan, which has criminalized most abortions but permits them to save the life of the mother. Does leukemia qualify as a reason for an abortion to save her life? Quote, it's so early we don't have the answer, said Dr. N. Lynn Henry, an oncologist at the University of Michigan. quote, we can't prove that the drugs cause a problem for the baby, and we can't prove that withholding the drugs would have a negative outcome. In other words, doctors say complications from a pregnancy, a miscarriage, a premature birth, birth defects, or death can occur whether or not a woman with a cancer takes the drugs. If she is not treated and her cancer gallops into the malignancy that kills her, that too might have happened even if she was given the cancer drugs. Administrators of the University of Michigan's medical system are not intervening in cancer treatment decisions about how to treat cancer in pregnancy women, saying, quote, medical decision making the management is between doctor and patients. Glenn Cohen, a law professor and bioethicist at Harvard, is gravely concerned, quote, we are putting physicians in a terrible position, Mr. Cohen said. I don't think signing up to be a physician should mean signing up to do jail time, he added. Oncologists, usually a part of the hospital system, Mr. Cohen said, which adds a further complication for doctors who treat cancers in states that ban abortion. Whatever their personal feelings, quote, he asked, and quote again, what are the risks the hospital system is going to face? End quote. I don't think oncologists ever thought this day was coming for them, Mr. Cohen said. Behind the confusion and concern from doctors are the stories of women like Mrs. Brown. She had a large tumor in her left breast and cancer cells in her underarm lymph nodes. The cancer was HER2 positive. Such cancers can spread quickly without treatment. About 15 years ago, the prognosis for women with HER2 positive cancers was among the worst breast cancer prognosis. Then a targeted treatment, trastuzumab or Herceptin, completely changed the picture. Now, women with HER2 tumors have among the best prognosis compared with other breast cancers. But trastuzumab cannot be given during pregnancy. Mrs. Brown's first visit was with a surgical oncologist who made it clear that my life would be in danger if I kept my pregnancy because I wouldn't be able to be treated until the second trimester. He told her that if she waited for those months past, her cancer could spread to distant organs and become fatal. Her treatment in the second trimester would be a mastectomy with removal of all the lymph nodes in her left armpit, which would have raised her risk of lymphomania and incurable fluid buildup in her arm. She could start chemotherapy in her second trimester, but could not have trastuzumab or radiation treatment. Her next consult was Dr. Lisa Carey, a breast cancer specialist at the University of North Carolina, who told her that while she could have a mastectomy in her first trimester before chemotherapy, it was not optimal. Ordinarily, oncologists would give cancer drugs before a mastectomy to shrink the tumor, allowing for a less invasive surgery. If the treatment did not eradicate the tumor, oncologists would try a more aggressive drug treatment after the operation. But if she had the mastectomy before having chemotherapy, it would be impossible to know if the treatment was helping. And what if the drugs were not working? She worried that her cancer would become fatal without her knowing it. Ordinarily, oncologists would give cancer drugs before a mastectomy to shrink the tumor, allowing for a less invasive surgery. If the treatment did not eradicate the tumor, the oncologist would try a more aggressive drug treatment after the operation. I feel like I said that already. That's weird. But if she had the mastectomy... Wait. Yeah, okay. She feared that if she tried to keep her pregnant, she might sacrifice her own life and destroy the lives of her children. And if she delayed making her decision and then had an abortion later in the pregnancy, she feared that the fetus might feel pain. She and her fiancé discussed her options. This pregnancy would be the first biological child. With enormous sadness, they made their decision. She would have a medication abortion. She took the pills one morning when she was 6 weeks and 1 day pregnant and cried all day. She wrote a urology for the baby who might have been. She was convinced the baby was going to be a girl and had named her Hope. She saved the ultrasound of Hope's heartbeat. I don't take that little life lightly, Mrs. Brown said. So, I know the heartbeat thing is often used as an excuse for people against abortion, but there's people who acknowledge that there's life with a pregnancy and they still, acknowledge that it needs to be terminated to save their life because there's no way around this shit. Okay. After she terminated her pregnancy, Mrs. Brown was able to start treatment with trastuzumab, along with a cocktail of chemotherapy drugs and radiation. She had a mastectomy, and there was no evidence of cancer at the time of her surgery. A great prognostic sign, Dr. Carey said. She did not need to have all of her lymph nodes removed and did not develop lymphodium. I feel like it has taken a lot of courage to do what I did, Miss Brown said. As a mother, your first instinct is to protect the baby. Now, as somebody who wanted to be a mother, she can say this, but I don't think there is a mother instinct necessarily. Again, because if you have the choice to want to raise or not, I feel like that goes against the inherent mother instinct. It just comes naturally if you actually love your kid and you have the means to take care of your kid and you're financially able to. All right. My bones ached. I couldn't walk more than a few steps without being out of breath, she said. It was hard to get nutrients because of the nausea and vomiting. The Supreme Court decision hit her hard. Quote, I felt like the reason I did what I did didn't matter, she said. My life didn't matter, and my child's lives didn't matter. It didn't matter if I lost my life because I was being forced to be pregnant, she said. And that's the end of that article. If you agree or disagree with my rhetoric, usually when I'm talking about shitting on a pro-lifer, you have to know they will keep ruining women's lives. Second-handedly, via letting it rot inside her, leaving children pregnant, with a 10-year-old. And now we can add eugenicist cancer through negligence. The conservatives can only pretend for so long that this is family values, a scientific misunderstanding, or whatever they pretend it to be, until we literally are pushed into forced sterilization phase. So, yeah. This might seem like some misunderstanding, but it's so beyond that.